So guys, let's define cellulitis. Cellulitis is the spreading inflammation of subcutaneous tissue and the facial planes. Okay? It is a spreading inflammation of the subcutaneous tissue and the facial planes. Infection may follow a small scratch, a wound, or an incision, or insect, snake, scorpion bite. Okay? It can be superficial or deep. The superficial is more common type and easier to diagnose. Fourth one, it is a common in diabetics, immunosuppressed people and old age. Okay. Then fifth point, it is common in face, lower limb, upper limb and scrotum. Why? Because the subcutaneous tissue is lax or loose over there. Okay. Cellulitis occurring in children is never primary but always secondary to an underlying bone infection. This is one important point. Okay. Cellulitis occurring in children is never primary, always secondary due to underlying bone infection. So, what are the causative agents? They occur commonly due to Streptococcus pyogenes and other gram-positive organisms. Okay. Then it occurs due to gram-negative like Klebsiella, Pseudomonas, E. coli. Okay. They usually cause secondary infection. Then what is the sequelae? The infection leads to gangrene. Then it can get localized to form pyogenic abscess, or it can spread to cause bacteremia, septicemia, pyemia. Okay. Then you should know the definition of necrotizing fasciitis. Okay. Extensive necrosis of skin and subcutaneous tissue is called as necrotizing fasciitis. Okay. Extensive necrosis of skin and subcutaneous tissue is called as necrotizing fasciitis. What are the features? First is pain, shiny red area, tenderness, warm skin. Okay. Second is fever and toxicity. Toxicity means tachycardia, hypotension. Third is no edge, no pus, no fluctuation, no limit. Okay. Fourth is swelling is diffuse and spreading in nature. So these are some features of cellulitis. When you see at the patient who is having cellulitis, you will get these features. Okay. Then what are the investigations? First, we will do CBC, then LFT, KFT, blood sugar, then venous Doppler, USG and X-ray. So these are some investigations which will be useful. How do you treat the cellulitis? First is elevation of the limb or the part to reduce edema as to increase circulation and bandaging. Then what are the antibiotics? Penicillins and cephalosporins are the ones which can be used. Then comes dressing. The most important question asked here is which dressing is used? The answer is glycerin dressing because it is hygroscopic in action. It reduces the edema. So glycerin, magnesium sulfate dressing is used. Magnesium sulfate, glycerin, they have hygroscopic action. They reduce the edema. Then the patient has diabetes, treat with insulin. If ketosis is present, then assess urine ketone bodies and provide IV insulin. Okay. Often patient may be in septicemia. Patient in such condition should be treated by higher antibiotics, critical care with fluid management along with maintaining adequate urine output. Okay. Then monitor. So guys, this was all about cellulitis. Cellulitis is one important topic where there are various small questions which can be asked in your Viva. So make sure to watch this video once again to make your concepts very good. Okay. So guys, if you have any doubt, write in the comment section. I will get back to you as soon as possible. And if you like the video, then share it with all of your medical friends and subscribe my channel. Okay. That will help me to grow my channel. Thank you.